everybody, Dr. Daniel, and today I'm talking about migraine disability. In medical school, I always heard that the three most disabling medical conditions were a kidney stone, childbirth, labor, and migraine. And later, when I had an office and I would be called to the emergency room, I found that the most common reason for the call was a patient with a severe migraine headache. Migraine is present in 12% of the general population, and is a common, usually lifelong neurological disorder which causes significant disability. Only about 48% of migraine patients have been diagnosed by a physician. The condition is most prevalent between the ages of 30 and 49 years old. Migraine is disabling, underdiagnosed, and undertreated. Migraine brings remarkable short-term disability, with 50% to 95% having trouble functioning during an attack. About 80% of patients experience disability or the need to go to bed during an attack. In general, migraine severely impacts work relationships, home life, and the ability to shop and get out. School children with migraine lose time from school each year. The estimate of lost work days is 2 to 4 days per year, and of decreased work effectiveness due to migraine as 4 to 9 days per year. In addition to lost work productivity, migraine is expensive when considering the economic impact of the expense of doctors' fees, blood work, and scans, and acute and preventative medication costs. Migraine results in increased utilization of healthcare costs. Migraine affects persons at the time of their most productive years and is more common than osteoarthritis, present in 7% of the population, diabetes, present in 6%, asthma, present in 7%, and rheumatoid arthritis, present in 1%. Nearly half, or 57% of migraineurs use over-the-counter medications, while 12% use a medication specifically indicated for migraine, like a triptan. Preventive therapy is offered more to women, to migraineurs with increased age, and those with increased severity of headache, which has elevated MIDAS scores. About 25% of migraineurs could benefit from preventive therapy, but most of these don't get it. 50% of migraine sufferers get frontal sinus, forehead and or nose located pressure pain, nasal congestion, tearing, and expression of clear fluid from the nose, which provokes them into thinking they may have a sinus condition, which the media calls sinus headache, a migraine myth. Age of disability. The peak age of involvement for women is 42 years old, while in men it is 38. The duration of individual migraines is shorter in men than in women, probably because of the long length of menstrual migraine in women. Men and women have no difference in number of attacks or in intensity. The diagnosis of migraine is not made in men as often as in women, perhaps related to the fact that their headaches are bilateral more than one-sided. The burden of headache is highest in females aged 18 to 44, where the 3-month prevalence of migraine or severe headache is 26.1%. The prevalence of migraine relates inversely to household income. The worldwide prevalence of migraine is relatively stable. Migraine severity. The severity and frequency of migraine may vary a lot among sufferers, while the attacks can range from mild pain to terrible agony and inability to function. However, a large proportion of migraineurs are moderately severely disabled. Frequency can range from 1 attack a year to 2 or 3 a week. Loss of productivity. In the United States, annual lost productivity due to migraine costs around $14 billion, while direct costs are thought to be $2.5 billion. The National Ambulatory Medical Care Survey showed that head pain was the 5th leading cause of emergency room visits overall in the United States and accounted for 1.2% of outpatient visits. Further questions. Migraine pain is severe. Migraine is disabling, chiefly because of the sheer intensity of the headache pain, so that the affected person has to stop their current activity and yield to it. According to the International Classification of Headache Disorders, version 3, migraine pain is, quote, moderate to severe, end of quote. In my office, when I asked patients to give a range of pain using a scale of 1 to 10, they often did not stay within the limit of 10 and answered 1,000. Migraine and nausea and vomiting. 80% of migraineurs have nausea and vomiting with the headache part. Nausea and vomiting are very disabling. Imagine being in an office situation and experiencing nausea and wondering if it would be so bad that one would vomit at their desk or on the way to the toilet. A very nerve-wracking and embarrassing situation. Migraine and sensitivity to light. Photophobia means fear of light. It is also a very distressing symptom. Again, consider this while being in an office with fluorescent lights that flicker, which especially seem to drive migraineurs crazy, or driving into the western sun on the way back home with a bright light of the sun in your face. Light sensitivity is a disturbing, interruptive problem, so that one doesn't want to open one's eyes at all, as the light seems to hurt in the eye and make the migraine pain worse. Many migraines are started by glancing light, like off a medallion on the front of a car, or flickering sunlight viewed through trees while driving. I've often written a prescription for light-sensitive migraineurs to use at their office to deter fluorescent light bulbs or any other aggravating light condition affecting their work ability. Migraine and anosmia, sensitivity to smell. This has been a special migraine problem for my office while I have run a headache clinic, and migraine patients do not want to smell any offensive odors in their doctor's office. My nurse puts up signs all over the office warning patients to be careful of offending odors or for other migraine persons. Once checking into a hotel with my wife, who is particularly sensitive to smells and who has migraine, we made 3 steps inside a supposedly smoke-free room when my wife informed me that she could smell cigarettes. I went straight to the phone and called the front desk for a room transfer. Migraine and movement. Consider how nice it is to finally lie down in bed at night after a long, stressful day, to stretch out your legs and relax. Migraine patients feel worse when they are up, and standing aggravates their headache. They need to be down whenever an attack occurs because it makes them feel so much better. Migraine patients want to lie down in a quiet, dark room. Consider that during an attack of migraine, persons with migraine have severe headache, nausea and vomiting, light sensitivity, smell sensitivity, the need to be down, and you will learn how migraine is very disabling. Now, I hope this talk is helpful to all you migraine sufferers out there. Please click on like and subscribe, and I will see you again or talk to you on the next podcast.